be sharing cases of where I have put absorbable stent in my practice. The first case was of a 40-year-old industrialist who had an MI while playing the tennis, and he came to me in the afternoon. And when I did the angiogram, there was a right coronary artery which was the culprit lesion. I put a BRS bioabsorbable scaffold and under the OCT guidance. And then after 2 years, when I called him for an OCT, I found that a scaffold was absorbed and the vasomotion was restored. The second case is also interesting. Is a 25-year-old young child from village. He came with anterior wall MI. I put an BRS stent here, and I did an OCT after a year's time, and the stent has already started to dissolve. So these are the cases where I did not want to put a metal stent, rather put an absorbable stent.
We see quite a good number of patients who come to us for angiography for their chest pain, and we see critical blockages in the main vessels like LAD proximal 90-95%, and we offer them angioplasty because that's the treatment modality for those lesions. But they have an apprehension in their mind that this implant will remain in the body for a lifetime. They don't want any metallic or permanent implant inside their body. For last 3 years, we have an option of offering them metal-free PCI with the advent of indigenous from Merrill Life Sciences, BRS, BioResorbable Scaffold, and after deployment, that it becomes a part of body. It dissolves slowly over 2 to 3 years time, and then nothing is left inside the vessel. So for these patients, we have an option, especially for the young patient with a critical lesion, with a short lesion. We can do angioplasty with BioResorbable Scaffold and metal-free PCI. And for the small vessel, if they have other blockages in the small vessel, which can be easily taken care by balloon dilatation and subsequently drug-eluting balloon. And by drug-eluting balloon also, they have less chances of reblockages. And in our experience, we have quite a good number of patients who underwent this metal-free PCI with the thin strut BRS from our indigenous company Merrill, and they are doing very well over the last 3 years clinically, as well as on the diagnostic angiography which we have done as a part of check angiogram. It's absolutely clean and pristine. Nothing is left beyond 3 years. And this is the treatment modality which we can offer in a good number of patients who are quite young and come with acute coronary syndrome, and they don't want any permanent metallic stent inside.
I'm involved with this next gen thin strut Miras 100 from Merrill BRS. Roughly around 50 patients, most of them were young, all were OCT guided. They are on good follow-up. I'm planning for an OCT follow-up down 3 years down the line too. All my patients were kind of simple lesions. I would like to continue with the device, even pretty little complex lesions also I want to do with this device. I want to produce my own data, and I'm very convinced with this device.